My name is Sherry Bermejo, and my daughter is Eva Bermejo, and she has bow ring obits.
I'm Nadia Mohaf Manning. This is my husband, John Manning, Johnny, and our daughter is 6.5 years old. Her name is Elise. She was diagnosed with Bainbridge-Roper syndrome, the ASXL3 gene.
When Eva was born, the first thing that I noticed is she had this bright heart-shaped birthmark on her forehead, clenched hands.
When she was first born, she was constantly in the hospital.
They whisked her away to the NICU because of some breathing issues, but assured me everything was right. And I think just her tone kind of gave me a sense of, I don't know if something's right. Within a week, though, we discovered within days, actually, that she wasn't feeding.
She just wasn't developing like a normal child. She wasn't holding her head up like a normal child.
They tested everything. We realized she was aspirating. They gave her a G-tube. We had seen a geneticist.
I found a geneticist who was able to swab Elise. They came back with results saying that we have an answer.
Eva tested positive.
It was nice to get a diagnosis because we didn't know.
I cried. I said, where do we go from here?
We cried a little bit,
and they said, we don't know.
My name is Amanda Johnson. I'm the executive director of the ASXL Rare Research Endowment Foundation. We are a family-led patient advocacy organization for ASXL-related disorders. There are approximately 500 individuals currently diagnosed in the world with these ultra-rare neurodevelopmental disorders, and many more people living undiagnosed without access to genetic testing.
I'm Bianca Russell. I'm a clinical geneticist. I specialize in the ASXL-related disorders.
Some of the common characteristics include global developmental delay, intellectual disability. Many individuals don't use words to speak, also have gastrointestinal complications, seizures, severe behaviors that are not only disruptive to the child, but to their homes as well.
There are not currently any specific treatments for the ASXL-related disorders. Instead, we treat based on the symptoms, which can be a significant challenge for families.
When we got Eva's diagnosis, I thought the world was open to us. I thought, yes, we have this diagnosis. We're going to be able to get Eva help. The doctors at Children's, they looked at me with a blank face. And I thought, oh my gosh, we got to do something about this.
There is no wizard behind the curtain who's going to answer all the questions, find the path to treatment, fund all the research and all the experiments that need to happen. We have to be the wizard.
It's been an incredibly exciting time for me to be a part of the ASXL scientific and clinical community. It's been wonderful to see how the families have come together with common goals of developing treatments and understanding best how to take care of their loved ones with these ASXL conditions. And it's been remarkable to see the network that has grown exponentially since I met those first few families as a medical student back in 2012.
The one thing that I can say as a parent is when you experience the lives of our children, there's something there that's worth finding solutions for making their lives better.